This is breaking news from the Las Vegas Review-Journal, sponsored by Las Vegas Paiute Tribal Smoke and Cigar Shop.
Good afternoon. I'm Carrie Roper with the Las Vegas Review-Journal. We're here with breaking news as we're waiting to take you to a press conference where Governor Steve Sisolak will provide an update on the state's COVID-19 response efforts. The governor's latest 30 observation period on what he calls the statewide economic pause is set to end this upcoming Monday, February 15th. The state currently follows a two-track vaccination plan that focuses on inoculating specific groups of essential workers alongside older residents. Over the past few months, we've heard updates from the governor on a regular basis, and in recent weeks, he's come out and spoken a little bit more often. COVID-19 metrics in Nevada have started trending downward recently, although state officials have warned that does not mean the state is in the clear. Now, Nevada has consistently ranked near the bottom of national rankings in vaccine doses received and administered. The U.S. Department of Health and Human Services has said that Nevada's actions have determined how many doses it has received. However, an analysis by the Review-Journal has shown that the state has been allocated the vaccine at a significantly lower rate than most other states. This afternoon's update from Governor Sisolak has business owners hopeful that with numbers trending downward in recent weeks, the governor will roll back restrictions on capacity limitations. Currently, they're at 25%, and they're start to move the economy forward, rather. Just last week, the governor announced an initiative aimed at distributing the coronavirus vaccine more equitably across racial and ethnic groups in Clark County. Again, we've seen a lot of these numbers changing since December, and we are past the year mark now when the first case of coronavirus was found here in the United States. As we've seen numbers tick up and tick down, we've also seen our hospitalization rates get to alarming figures in recent weeks. Those have started to trend downward, however. We are still waiting for the governor to speak here shortly, and we will check in with him. But also be sure to stay with us here after the press conference for more information. We're going to be breaking down everything the governor says. Everything he gives a wrap up for, we will be here for. Again, make sure you follow us here on lvrj.com. We are also here at 7 a.m. and 7 p.m. with our 7 at 7 show. You can find us on lvrj.com, streaming platforms, Apple TV, Roku, and we bring all these updates to you as well as the latest headlines as they come from our Review-Journal team here in Nevada. Let's go ahead and check in with the governor as he's just about ready to speak. Let's listen in.
A few important updates related to the state's current COVID-19 mitigation measures. But first, I want to take a moment to provide an update on the progress of vaccination in Nevada. I am so grateful to the state team that's been working hard to provide support to our local partners and focusing on efficiency and equity as we continue to roll out this historic vaccination campaign. A little over a month ago, I asked the Nevada National Guard Division of Emergency Management and the state immunization team to work together to identify challenges and implement solutions. The results have been remarkable and should make us all proud. Earlier this week, FEMA released a report indicating that Nevada continues to perform among the top in the country in administering the state's allocation of vaccine. That's something to be proud of. We know we can do more with more doses, and the dedication and hard work of partners statewide has been instrumental, but there is more work to be done. As of yesterday, more than 307,000 first doses have been administered to Nevadans and reported to the state system, along with over 82,000 second doses, totaling more than 390,000 doses administered statewide. I want to thank our federal partners who in recent weeks have provided substantial support to our state in the form of personnel, providing us staff to help alleviate the data backlog, and vaccinators to get more shots in arms. We continue to work closely with the new administration and federal agencies and remain optimistic about the increase in direct and regular communication and support. My staff and I are in contact every day with representatives from the federal government to get more vaccines. Finally, thank you to our many local partners, including the local leaders, vaccinators, volunteers, and organizers on the ground. This is a Herculean task and would not be possible without your tireless efforts. Every time a challenge is identified, we are finding a solution. Most importantly, we are ready and able to vaccinate more Nevadans as soon as we get more doses. We are grateful for the recent increase in doses from the federal government, but we know Nevadans are anxious to be vaccinated, and we will continue to work with our federal delegation to fight for more doses. In addition to receiving more doses for Nevadans, it is vital that we meet our residents where they are. We need to ensure we have locations in communities and are able to overcome barriers to reach all Nevadans. I'm proud of the partnerships we have built and excited that Walmart and Sam's Club pharmacies will begin administering vaccine through the federal retail pharmacy program. More than 36 Nevada locations will participate, offering a convenient location for residents to make an appointment to be vaccinated. As you all know, each week Nevada receives a limited number of doses of COVID-19 vaccine, which is a challenge for everyone. But every single dose is a small step forward. These doses are going to locations throughout Nevada, and I am proud of the partnership we have with our statewide coalition, Immunize Nevada. Information on who is eligible to be vaccinated and where vaccine is available is all compiled by Immunize Nevada on one website. That's nvcovidfighter.org. Each county's plan is updated there, so Nevadans will know where they can make an appointment in their own community. Or, if you need a helping hand with the process, we've set up a hotline available 8 a.m. to 8 p.m. 7 days a week. They can help you make an appointment or answer a question. That number is 800-401-0946. That's 800-401-0946. And in the 2 weeks that the call center has been open, they have already answered more than 25,000 calls. Neighbors helping neighbors. We are all in this together, and I know Nevadans are looking out for each other, staying connected virtually or making sure the seniors we know understand how to make a plan and an appointment. I urge all Nevadans to reach out and offer support for those who may need it. Vaccines have provided us some hope during the worst of this pandemic. Like the rest of the country, Nevada experienced multiple surges over the recent winter months, resulting in a record high statewide positivity rate of 21.7% in January. Daily case counts that reached a high of over 2,700, that's 2,700 in mid-December, and our highest peak of hospitalizations in late December, with 2,126 confirmed and suspected hospitalizations. But also, like the rest of the country, Nevada has recently been experiencing steady progress in terms of our COVID-19 trends, which I know is welcome news to all of us. As of February 11th, the test positivity rate over the last 14 days is 14.3%. The average number of daily new cases over the last 14 days is 684. And recently, the Nevada Hospital Association reported Nevada is continuing to see a downward trajectory in hospitalizations. As of February 10th, Nevada had 879 confirmed and suspected hospitalizations. These are significant decreases, and I'm grateful that the statewide pause, as difficult as it has been, has helped Nevada mitigate the spread while COVID transmission was surging across the country. I am grateful to Nevadans across the state who continue to stay home when they can, to mask up, to socially distance and follow other mitigation measures to protect themselves and each other. It's important to look back at where we've been as we chart our new path forward. Our recent progress is significant, but we also started at record highs across the board, and our trends today are still double what we experienced in mid-September after recovering from the summer surge. In fact, the Nevada Hospital Association warns that this good news does not mean that people should let their guard down. With case counts remaining near the previous wave's high, hospital capacity could quickly be stressed if the trajectories change course. We can't let that happen. That's why the next steps we take must be strategic and responsible. As we continue navigating this pandemic and ramping up our vaccination efforts through an efficient and equitable approach, plans for safe reopening must focus on how we can continue mitigating the spread while getting Nevadans back to work, protecting and recovering our economy, and getting our students back to in-person learning in the safest way possible. Let me repeat, getting our students back to in-person learning in the safest way possible. According to state public health officials, a critical component of a successful reopening plan is that we continue to follow the mitigation measures that are proven to work while incrementally loosening restrictions. I also know that after making it through the very difficult winter surges and the pause, Nevadans want and deserve predictability about what our path forward will look like. This is what was front of mind as we developed this Roadmap to Recovery Safe Reopening Plan. This plan is aimed at ensuring success for the long term and not just in the immediate, and providing predictability through a clear timeline. That's why today I am announcing our timeline for a safe reopening, which starts this Monday, February 15th, and goes through May 1st. In a moment, I'll walk through more specifics, but I wanted to start by providing a quick overview. Beginning on Monday, February 15th, a first round of capacity limits will be lifted at various levels based on risk level of the activity or business type identified by health experts. Gatherings will be lifted to allow 100 people or 35% capacity, whichever is less, with strict social distancing. Additionally, large gathering plans may once again be submitted to local health authorities for review, and then to the appropriate state agencies for potential approval, in line with the same large gathering plan process initiated last fall. However, any approved large gatherings can only begin to take place starting March 1. On March 15th, the next round of capacity and gathering restrictions will be lifted, with a full return to pre-pause levels. This will result in almost all businesses in the state returning to 50% capacity and gatherings to 250 people or 50%, whichever is less, with strict social distancing requirements being met. Finally, on May 1st, the goal is for the state to transition decision-making authority on mitigation management of businesses and activities to local authorities. I'll speak more on this biggest step in a moment. As we ease restrictions, we must follow the science and studies which states clearly and repeatedly that closures to certain settings are more impactful in reducing disease transmission. According to the experts, mitigation measures in these high-risk areas should be extended longer and used responsibly to help slow the spread. To be clear, businesses or activities deemed higher risk by scientific evidence are not the fault of business owners or anyone else. I know our bar and restaurant owners and others are doing everything they can to keep their staff and customers safe. The unfortunate reality is that COVID-19 transmission risk increases with the number of individuals in one location, the ability to wear masks, the amount of ventilation, and the length of exposure. For example, individuals dining indoors are likely to remain in the location for a longer length of time with their masks removed, and sufficient ventilation cannot be guaranteed. That's why we will take this responsible approach and ensure all settings have the support they need to reopen safely. Beginning on February 15th, here is what will be moving to 35% capacity. Places of worship, gyms, fitness studios, yoga studios, martial arts studios, and similar establishments, gaming floors, arcades, racetracks, bowling alleys, pool halls, and similar activities. When it comes to restaurants and bars, indoor dining and beverage service will be capped at 35% capacity. Outdoor dining will not have a capacity limit, but will have to adhere to all social distancing requirements. Reservations will no longer be necessary starting on February 15th, and we will increase the allowed number of patrons per table from 4 to 6. The following will be moving to 50% on February 15th. libraries, museums, art galleries, aquariums, and zoos. Additionally, public gatherings and events can increase to 100 individuals or 35% of fire code capacity. Finally, organizations may begin submitting large gathering plans beginning on February 15th, but no events can resume until March 1st, and only if reviewed by local health authorities and approved by the appropriate state agencies. The same process that was in place prior to the initiation of the pause. Venues eligible for large gatherings will be capped at 20% of the total fixed seat capacity and must follow strict social distancing requirements and be able to adhere to all mitigation protocols. And again, they will only be able to take place if their submitted plan is reviewed by the appropriate local health authority and approved by the state. The next big date is March 15th. On March 15th, all the businesses operating at 35% will be able to move to 50% capacity. Public gatherings will also move to 250 people or 50% capacity. This will return the state to full pre-pause levels. From now until May 1st, retail stores, indoor malls, and community and recreation centers will remain at 50%. Spas, massage establishments, hair salons, barbershops, nail salons, and other businesses that provide aesthetic skin services will continue to operate under strict social distancing and under the authority of the applicable state licensing boards. Additionally, certain high-risk businesses and activities, adult entertainment establishments, nightclubs and day clubs and brothels will remain closed until at least May 1st. And finally, May 1st marks the date where we hope to reach our ultimate goal of transitioning mitigation management to local authority. In order to reach this goal, counties will have from now through the end of April to demonstrate a decrease in COVID trends, adequate hospital capacity within their region, and evidence that they can continue performing at an adequate level of testing and other response efforts for their communities. Even when we move to local management, specific statewide protocols will remain in place to mitigate the spread, including but not limited to the mask mandate and other social distancing requirements. Between now and then, the COVID-19 Management and Mitigation Task Force will work with counties to develop plans that will help prepare for a smooth transition to local control beginning May 1. The task force will also continue to monitor the COVID-19 situation in each area of Nevada and provide state assistance as needed to ensure we continue to see improvements. And as always, while we are hopeful that trends will continue to decrease, if all mitigation measures are followed, we must remain flexible, as we have done all along. We will continue to monitor data trends throughout this timeline and work closely with counties and local health authorities to evaluate next steps should a significant increase begin to occur. Now I want to speak directly to local leaders. I know your communities trust you. They trust you the most. I know that you know that too. That's why I'm asking for you to talk directly to your neighbors about the importance of getting the next 75 days right, so you can go back to the local level and manage this the way you think works best for your community. The best part of this plan is that it's in the hands of every Nevadan, every community. If we all want to see this transition to local control, let's work together to continue decreasing our community transmission. Providing an adequate amount of time between the first step of reopening and the transition to local authority at the county level allows local governments the time to prepare for the transition, allows the state to monitor the impact of vaccinations, and allows public health officials time to monitor any potential impacts of the new COVID-19 variants. Most importantly, and as I have said repeatedly, one of my main priorities is to get children back to school in the safest way possible. To date, 16 of our 17 counties have been able to bring students and educators back in some fashion. Clark County School District, our largest school district, has also been working hard to make this happen. But as of today, more than 300,000 students have not been inside a classroom for close to a year. For close to 365 days, they've not seen the inside of a classroom. Fortunately, on March 1st, Students in pre-K through third grade will have the opportunity to return to school in Clark County. Recently, the CDC has said that school reopening can be done in a safe way, but only if we're doing everything we can to manage community transmission outside of the school walls. This reopening timeline takes this into consideration. We have to make sure we're doing everything we can as a state to make sure the reopening of our largest district is successful, in addition to protecting the students that are already back in classrooms throughout the state. These children, our educators, our bus drivers, our school nurses, they're worth protecting and prioritizing in this moment. I know all Nevadans will agree. We're going to make it through this. The goal of this plan is to avoid a scenario where I have to come back before all of you again and pause our efforts. I don't want to do that. I believe this plan can work. I believe it will work, but we must all invest in making it successful. 75 days to trust the science, listen to our public health experts, mask up, get a vaccine if eligible, practice social distancing, and see our numbers decline. I want to see our children return to in-person learning in the safest way possible. I want to see Nevadans get back to work. I want to see small businesses thrive. I want to help relaunch our missed and needed convention business, including the World of Concrete Convention, taking place in Las Vegas this June. I want to see business travel to Nevada make a comeback, boosting our economy and putting folks back to work. I want to give our healthcare workers a needed break from 11 straight months of shift after shift after shift, caring for the COVID patients. I want to return to Nevada we know and we love, but I want to come back even stronger. Together we can do this. There is hope, Nevada. Shots are getting into arms. And the American Rescue Plan brought forward by the Biden-Harris administration is moving through Congress. That plan will bring Nevada much needed assistance and much needed relief. That plan, paired with the vaccination efforts, will be a tremendous help to the state of Nevada. But until then, we must continue to mitigate the spread. Thank you all for being here. I will now take some questions from members of the media on the call. I think some of my staff is here on the line to help coordinate and facilitate this process.
Thank you, Governor Sisolak. This is Megan Delaney, Comms Director. I see I have folks already raising their hands. If you're a member of the media on the call and you want to ask the governor a question, please feel free to use the raise hand option. If you go under reactions, there should be a raise hand button. So I saw Bill Denser from the RJ first, and then we'll go to Megan Messerly after that. So Bill, if you can unmute yourself, you can ask the governor your question.
Thanks, Megan. Thanks, Governor, for doing this. Couple of questions on vaccines. So you mentioned 390,000 have been administered. I'm wondering how many have actually been received here, and if there's any kind of bottleneck between getting them deployed here and getting them into people's arms. And then second part of that is there a time frame at this point for when the state thinks they'll get certain benchmarks for number of people vaccinated?
Well, I mean, we have a regular call, I think it's 3 times a week with Candace and Caleb about the number of vaccines that we're getting versus a number that are actually going into arms. I can tell you that FEMA has recommended, has acknowledged that we're amongst the top states in administering vaccines that are given to us. I cannot give you a timeline in terms of when we can get to that part where all Nevadans can get a vaccine, because there's so much more happening. More vaccines are being provided, hopefully have been ordered. I saw today, President Biden acknowledged he ordered another 200 doses of the vaccine. The J&J vaccine should be coming online, hopefully within the next month or so. And there's a couple other companies that are during the process of asking for approval. So that's a work in progress, and I can commit to you and verify the fact that every day my staff or I are on the phone with our leaders in Washington talking about this very issue and fighting to get every single dose into the state.
Thanks, Bill. We'll do Megan Messerly, and then after Megan, we'll go to Vanessa Murphy on deck. I think those are the right baseball terms.
Thanks for doing this, Governor. Another vaccine question for you. So we're seeing a lot of folks getting vaccinated as frontline community support workers because their industry is prioritized for vaccination, even though they work from home and therefore are not recommended for prioritization under the state's vaccination playbook. There's currently no way right now to verify at mass vaccination sites whether people who've made appointments are true frontline workers with exposure to the public. Do you see this as a problem, and what do you plan to do as governor to address this?
Well, my staff and our team has put forward a tremendous amount of time putting the playbook together, and I think they've done a tremendous job. That's been disseminated and distributed to all of the local health districts, and it's incumbent upon them to make sure that that playbook is followed. I think they're doing a relatively good job. They're doing what they can. There are always going to be isolated cases. You see that all over the country where there's someone as you call, jump the line or not quite be qualified. But we're doing everything humanly possible to get needles in people's arms as quickly as possible.
Thanks, Megan. I think I said Vanessa next, and then we'll do Sam Metz from the AP.
Thanks for taking my question. Governor Sisolak, you may have seen how we're experiencing long lines at vaccination sites. The Clark County Convention Center is an example today with seniors 70 and up standing for hours. With all due respect to the hard work going into this, and while I know you don't run the Southern Nevada Health District, is it time for the state to team up to try to help fix technical issues, to perhaps do drive-through vaccination sites? They're doing those drive-throughs in California.
Well, my team has been in Southern Nevada. They're working with Southern Nevada to help alleviate these situations. We're taking federal advice as it becomes available on this. We certainly don't want our seniors, our most vulnerable, standing in line for hours. I hear that they're standing in line for hours, and then the health district is telling me that 15% of the people aren't showing up for appointments, and there's duplicate appointments. This is a Herculean task to undertake. We're doing everything we can. I encourage people to make an appointment and show up at their appointment time for the vaccine. That's the best way to ensure that you don't have to stand in line. But for right now, the health districts, the local districts who are closest to the people are the ones that are responsible for administering the vaccines, setting the appointments, and taking care of those individuals.
Thank you, Vanessa. We'll go to Sam next, and then we'll do John Sadler of the Sun after Sam. Go ahead, Sam.
Hey, Governor. Thank you so much for taking
Sam.
my question.
Sure.
When you say that statewide guidelines will remain in place in the counties and the task force will help transition plans starting in March, I want to clarify, will the plans require task force approval? And can you explain what it means in terms of local control, that statewide guidelines remaining in place will, quote, include but not be limited to face covering and social distancing safety protocols? Which ones?
Do you mean the transition in May?
The transition in May that the roadmap says the task force will start planning for in March.
Right. The task force, they'll start making preparation that hopefully in May, it's our goal and our desire to turn this over again to the local communities that are closest to the individuals, to the businesses, and give them the authority to set regulations and protocols as it relates to COVID mitigation. Now, the state will be here to help them with those protocols, to provide information, to provide data, and to ensure that they are meeting the factors, so to speak, that the positivity rate continues to go down, the cases continue to go down, that there's adequate hospitalization. This is not an either or. This is a collaboration that we're doing with the local health districts to ensure that they're ready at that time in order to do that, to accomplish it. Because it's in everyone's best interest that we can get this over to the local jurisdictions. And it's our goal to do that, like I say, by May.
So after May 1st, would counties have the freedom to reopen things like brothels, or would the state still need to review and approve that?
Well, that's something that's open. It's the same that is open that, we're going to continue to keep some things in place. Certainly the mask mandate, the social distancing, the details of how we can put it over are going to have to be worked out because we've got cities inside of counties and some counties are larger than other counties. So these are all factors that we're going to have to work out, but we've got 75 days to do that. And I'm sure that in collaboration with our partners, we'll be able to get it done.
Thank you.
Thank you, Sam. Thanks, Governor. I think I said John Sadler would be next, and then we'll do Jacqueline Schultz from Fox 5 after John. Sam, if you're able to lower your hand on your end, that would be great.
Hi, Governor. Can you hear me?
I sure can.
Thanks for doing this. I had just kind of a clarification question. When you say you're transitioning or hope to transition to local authorities on May 1st, is this county going to be in control? Is there any city control involved with this? Could you explain a little bit about that?
That is one of the situations that we're going to have to work through the counties and the cities to see what the most effective method would be. There's going to be some jurisdictions where obviously there's going to be an overlap. And you've got several large cities or cities inside of a county, and an unincorporated county might be there. But those are things that we hope that everybody can get together, those local jurisdictions, and come up with a plan that would benefit everybody and give them the resources necessary.
Thanks, John. I think I said Jacqueline Schultz was on deck, and after Jacqueline, we'll go to James DeHaven. I know, James, you said you were having trouble raising your hand, so thanks for sending me the chat. So Jacqueline and then James.
Hi, Governor. Can you hear me?
I can. Go ahead, sure.
Great. Governor, is Clark County doing enough at this point to vaccinate minorities in zip codes that are challenged with high positivity rates? Are they addressing that problem that you raised? And when can Clark County, when realistically, with the doses we're getting, could we eventually even get into the general population?
Well, you know, I made my point very clear as it related to the underserved population and the inequity that existed, I felt, in vaccinations. I know that the counties are aware of that. I know that the local leaders are aware of that. I know that the health districts are aware of that. And it's incumbent upon them to take that information and hopefully move forward with it. I don't want to say they're doing enough or not doing enough. They've been great partners. But equity is about access. Everyone is working hard at this, and I just want to reassure you that this is an enormous Herculean task. You know, my biggest effort that I put forward every day, I come in here and I leave here making the next phone call to get more vaccines into the state of Nevada. My staff spends an entire day on the phone talking to the CDC, to FEMA, to the FDA, to all the various agencies about potential of getting more vaccines in here so we can plan and be ready for distributing that. It's my hope and my goal that in the foreseeable future, as the president has said, we'll have enough vaccines to open it up to just everybody and eliminate a lot of these problems. Right now, there are more people wanting the vaccine than we have vaccines to give. And that'll continue for a while, but we're fighting every single day to get more vaccines in here. And we're working with our local partners to make sure those are distributed in an equitable and fair manner.
Thanks for the question, Jacqueline. Thanks, Governor. We'll do James, and then we'll go Mary Hines from the RJ after that.
Hey, Governor, how you doing?
Good.
I'm curious if the state will step back in the event that, you know, after the transition to local authority, in the event that a county experiences a surge in cases, does the state swoop in, or how does that work?
Well, the state's always going to be here to provide help and to provide assistance and to provide information. We have data that they can use, we have information, and we have an infrastructure that they can use. You know, we want to give this to the local jurisdictions, whether that be the cities or the counties, but I'm confident we can work this together, you know, that we can make this work. And if they need our help and they need us to step back in and provide more guidance, we're here and willing to do that. But they're the closest to the people, to the citizens. And I think it's fair that they have the opportunity to make changes, to make adjustments, and together we'll make this work. But it's a collaboration, it's a team effort.
Thank you, James. Thank you, Governor. We'll do Mary Hines, and then we'll do Terry Russell after that.
Thank you. Good afternoon.
Hey, Mary.
Hey, Governor. I've spoken to some public health authorities who say that Nevada's cases and other indicators, although improved, remain very high, too high to begin easing restrictions. What do you say to that?
Mary, this has been a difficult issue, and I hear this every day. Some people want you to open everything up. Some people want you to close everything down. Some people want you to have no capacity limits. Others want strict capacity limits. Some people want schools open. Some want schools closed. Every decision that we've had to make, that I've had to make for the last year, has been fraught with, there's two sides to it. It is a difficult tightrope balancing act to attempt to keep our people as safe as we can by vaccinating them, protecting our healthcare workers and our hospital capacity, and at the same time, get our economy moving. We've got unemployment that's still too high. I've got too many people that are out of work that are looking to go to work, and businesses that are struggling and hanging on by a thread. And I encourage everybody out there that's listening to this, Mary, patronize a small business when you can. Buy a gift card. Get me food to go from a small business. Give these people a chance that they can keep their businesses going, because they've been there for us and we need to be there for them. But it's always going to be criticized whether we do more or do less, and we're trying to find that balancing, that middle spot, and I think we're doing well in terms of doing that, and we're going to get through this together and come out stronger on the back end.
Thank you, Mary. Thank you, Governor. We'll go to Terry, and then we'll go to Jackie Valley. If you're having trouble raising your hand and you've messaged me, I see you even if I'm not responding. So thank you for that. Terry, and then Jackie.
Governor, you're trying to get more vaccinations. You've encouraged medical professionals to go to Serve Nevada, sign up to volunteer. And I have been getting some many inquiries from local physicians here who indicate that the Serve Nevada website is for future emergencies, that it's full of bureaucracy. Specifically, it's asking them to perform a full background check, which they've all agreed to, but they say we are not in a future emergency, we're in an emergency now. And shouldn't the a license in good standing with the medical board, as well as hospital privileges, suffice to be able to deliver a shot in the arm, considering many of these people are doing surgeries, doing anesthesia, delivering babies, and many of them have filled the forms out and have waited more than a month and have not heard from counties, anybody else about where their standing is to volunteer their time, yet they're now able to volunteer their time and deliver shots at local hospitals.
Well, you know, that's a difficult situation. I appreciate, Terry, the question. We are working with our local health jurisdictions to accommodate this. We appreciate the volunteerism spirit. Understand a lot of these folks want to vaccinate in their offices. We don't know if they have adequate storage facilities, put vaccines in there. A lot of them are willing to come to a location. We have loosened the requirements for vaccinators. The reality is, I'm short of vaccines. I'm not short of vaccinators right now. The hope is that in the immediate future, short-term future, we'll get enough vaccines that then I'll need these vaccinators. Right now, I'm not getting shots in arms as a lack of vaccinators. It's as a lack of vaccines. And we're doing everything we can to get more of those.
Thank you, Governor. Thank you, Terry. I believe DHHS is working with you on that as well, so we can try to loop back and get you some more information if you may need it. I think I had Jackie Valley of the Indy next, and then we'll take Shay Johnson from the RJ after Jackie.
Yes, thank you, Governor. My question is this. There's been talk about whether domestic travel restrictions would help curb the spread of new COVID variants. Do you support such domestic travel restrictions in areas experiencing outbreaks of those new variants?
I don't know what kind of restrictions you're talking about, Jackie. If you're talking about testing or proof of a negative test or vaccine before they get on an airline, a flight, that's regulated by the FAA. And, you know, hopefully they're listening. I know they're listening to everybody's input, but like I say, that gets into the nuances of, you know, what the restriction should be or shouldn't be as results in air travel. And obviously it's my goal to get as many people as we can once we're through this and recovering into the state where we can help our economy recover. At the same time, it has to be done in a safe basis. But I know there's a lot of smart people at the FAA working on how this should be handled in airports and on airplanes.
Thanks, Jackie. We'll do Shay Johnson, and then I had two folks. I had Brett Forrest and Howard Stutz in the chat, and then we'll probably pull to a close after those. So Shay, and then Brett, and then Howard. Thanks, Gov.
Shay?
Shay, are you able to unmute yourself and ask a question? I think I just heard you.
I am. Hi. Good afternoon, Governor.
Hey, Shay.
In Clark County, local governments have offered all their employees, or in some cases, most or many of their employees, opportunities to be vaccinated under this continuity of governance category within the playbook. Have you been satisfied with how local governments have interpreted the guidance in the playbook with respect to continuity of governance? And does giving access to a broad group of government employees align with the playbook's intentions?
Shay, it's been my goal since the beginning, and I'll make it clear. We had two buckets or trails or tracks, whatever it might be, in terms of how to get the vaccine. The first is to our age categories, 70 and over, to get vaccines in their arms. And there's a second category for our frontline workers. Now, whether those essential workers, whether those are how it's interpreted, the frontline, the essential workers, and the continuance of governance is up to the local health districts. I'm not standing in one of the vaccinations lines asking to see people's ID and where they work. It's the responsibility of the health districts to make sure that the vaccines are going to the right people. Now, understand there's a personal responsibility here as well, because if there's a group of people or a group of individuals or whatever it might be that are getting vaccines that really shouldn't be getting them, they're taking those vaccines away from people that need them. They're taking them away from your 85, 90-year-old grandmother or parent. They're taking them away from the frontline worker who's been working every single day during this pandemic, or the healthcare worker that's working a shift every single day to take care of us. If the vaccine's going to somebody that shouldn't be getting it, it's taking it from someone who should. It's not a matter of there's no consequence to it. The matter is that we're trying to get it in the people that are most desperately required to have it as soon as possible. And that's the local health districts that are responsible for administering and complying with that playbook. And I'm counting on them to do that.
Thank you, Shay. Thanks, Governor. We'll do Brett Forrest and then Howard, and then we'll pull to a close.
Hi, Governor. Brett Forrest here. Could we just get some clarification on the youth sports resuming March 15th? Is that going to include the high school sports? And what about the sports on the do not play list, like football? Will those end up being able to be played this year?
We're working through that right now as we speak. Brett, it's something that my team has been in contact with the NIAA several times a week to determine that. There are club sports are now currently allowed. Your soccer, your baseball, softball, that sort of thing. We're working on bringing some more tournaments, allowing some more tournaments to come back in. And that's something that we didn't quite get done before today's press conference. We hope to have some guidance in that area in the next few days. But we are currently working with the club sports folks and the NIAA. When you talk about the high school sports, I'm going to cut right to the chase. My primary concern is to get them in a classroom. I'd like to get them on a court. I'd like to get them on a baseball field, a soccer field, a football field, whatever it is. I'd love to see that happen. But first, I want to get them in a math class and an English class if I can. And that's where our emphasis has been. But we are working on sports.
Thank you, Governor. Thanks, Brett, for the question. We'll go to Howard Stutz for the last one today, Gov.
Morning. Good afternoon, Governor. How you doing?
Good, Howard. How you doing?
Good. A couple of questions. The last call you did, you talked about moving casino workers or up into the frontline employees for vaccinations of the hotel tourism employees. Right. I was curious where that stands. And then the other question deals with when you transition this over on May 1st, won't the Gaming Control Board have ultimate say of what happens with the casinos and on the Strip and downtown and in Reno, going forward, rather than over the local authorities?
Well, let me answer your second question first, Howard. And nobody knows more about the gaming industry and hospitality industry than you. I mean, you've been around a long time. You do a lot of writing on it. I know you're an authority that people go to. Yes, to answer your question, the Gaming Control Board and the commission ultimately have authority over any licensed property. And they can always step in. They can always make requirements. They can always issue violation notices. They can always issue fines. So we'd go to the local governments to work with the Gaming Control Board, but ultimately the Gaming Control Board would make that call if it came down to that. As it relates to the workers, our frontline workers, hospitality workers, and I want to be crystal clear about this, they are prioritized for vaccines. Now, we're one of the few states that have done that because we totally understand the importance of our hospitality workers. I mean, I talked to the culinary workers and they've lost members to this disease, have passed away. And it's important that every one of these folks that are having a face-to-face interaction with our tourists that are coming here get a vaccine and are protected. And we want to do that for several reasons. One, we want to protect our workers and our residents. And two, I want everybody coming here to know that this is the safest place to come for a vacation. You can come here and you don't have to worry about one of the hospitality workers potentially infecting you. So yes, they are prioritized. And yes, the Gaming Control Board ultimately, under the leadership of the chairman, Bryn Gibson, has control over those issues.
Thanks, Governor.
Thank you.
Thanks everyone for joining us today. We'll have some more information on the governor's plan that we'll send out and that we'll post on nvhealthresponse.nv.gov as soon as we pull to a close here. So thank you, Governor, and thank you everyone for joining us.
Thank you all.
Steve Sisolak providing an update on Nevada's COVID-19 response and vaccination efforts, giving some relief to small businesses and telling Nevadans that there is cause to be optimistic. Well, January may have set several COVID-19 records in hospitalizations, transmission, and deaths. However, numbers are showing a more positive outlook, and the governor explained that he and state officials continue to work with federal partners to get more shots in arms. And with that in mind, he provided an outline of the next 75 days, with the end goal being that local governments will assume control of COVID-19 mitigation efforts. He announced that some restrictions will begin to be lifted as early as this Monday, February 15th. That means some restrictions on capacity limits and mass gatherings will be increased to 100 people max, or 35%, whichever is smaller. Other restrictions will be lifted March 15th and May 1st in stages. The governor also saying that what happens in this time frame could determine whether or not students can return to school and start the process of recovering the state's economy. He also said that FEMA determined that Nevada is a top priority state to get more vaccine doses, though he did not add anything about the actual rollout of these doses. A lot that the governor covered here today, a lot that our team is continuing to follow up on. To hear more about what the governor had to say, be sure to go to lvrj.com or be sure to check back in with us tonight for 7 at 7 p.m. and tomorrow morning at 7 a.m. we will have some of the local business owners' reaction for you. Be sure to stay with us right here. Thank you so much for joining us today. I'm Carrie Roper for the Las Vegas Review-Journal. Have a safe evening.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Las Vegas Paiute Tribal Smoke and Cigar Shop.